Hey everybody, Dr. Mark Fondino here with Davidson Chiropractic. Hope you're doing well. Today I wanted to talk about cardiorespiratory fitness. And actually I was on surfing online and I saw a news feed come up. CNN had written an article about an article called Association of Cardiorespiratory Fitness with Long-Term Mortality or Death among Adults Who Underwent Exercise Treadmill Testing. And so I looked up the article. It was in JAMA, and this is kind of the general gist. They grouped 122,000 different patients, and these patients were getting exercise-induced treadmill tests because of various reasons. Number one, they might have had hypertension. They might have been diagnosed with coronary artery disease. They might have had end-stage renal failure or renal disease. They could have had hypercholesterolemia or high cholesterol. High lipid levels. They might have been obese. So these are various reasons why a patient might get sent out for some exercise induced treadmill testing. They looked at over 122,000 patients. 59% of them were male. So that made over about 72,000 patients. Also, there were smokers involved in that group, cancer, people that had cancer that also had suffered stroke. And they followed these people they did this testing from 1991 all the way to 2014, and they followed up over 8 years. So I think the average follow-up period was 8 years. So if we started in 1991, obviously there was plenty of time to follow up with them. So this was a pretty large-scale test with 122,000 patients. They also had different groups. There was a lower 25th percentile of fitness, so to speak. There was a average fitness level from about 26% to 49%. There was above average from about 50 to 74%. There was high above average from about 75 to 96%. And then anything above 96%, if you scored in this bell-shaped curve, was the elite performers. So what they found also, which was interesting during the course of the 20-some-odd years, 1991 to 2014, is that the age of the population that were being seen, which was about 59 years, plus or minus 12 years, they all had similar conditions, the hypertension, the smokers, the post-stroke patients, the coronary artery disease patients. So that didn't change over the 20-some-odd years of looking at these patients. But what did change is they saw increased medication usage for these heart-related conditions, such as high cholesterol levels, hypertensive, coronary artery disease patients. These patients were, over the period, were getting more and more medication. So they saw more people on either higher dosages or various cocktails of medication, so to speak. So I thought that was interesting. After the follow-up period of 8.5 years or 8.4 years, they found there was 13,637 deaths during that follow-up period. So that's where we got that all-cause mortality, we call it, or death, that happened over that time period. So what can we gather from this? What kind of helpful, useful information can we take away to help reduce our all-cause mortality due to these chronic conditions that develop, but basically not taking good care of ourselves? Number one, the greatest performance were the people who did the best on this exercise treadmill testing which makes sense, were the ones that didn't have a lot of these comorbidities. So the ones that didn't have coronary artery disease, those that didn't have past strokes or cancer or diabetes or obesity. So those were going to be and that made sense. Those were your higher level performers. Though there was one exception. Those that had high cholesterol, actually, those were 31.6 of all those hyperlipidemia patients were one of the elite performers. So 31% of all elite performers had high cholesterol levels, is what I'm trying to say. Number two, there was no plateau effect, meaning we used to think with exercise that you'd reach a point where you exert effort, and eventually that effort that you exert you would not see any improved benefit from that exertion of exercise over years. This was actually a myth in this case, that the more you performed, the better your fitness got, your rate of all-cause mortality related to some chronic conditions continued to diminish to a good extent. So there was actually what we call a dose response. The more you did, and enough to tax your body where you improve cardiorespiratory performance, you saw a decrease in your likelihood of dying from these chronic conditions. Now there was one exception. Well, actually, if you're older than 70 years old and you had hypertension, it made sense for you to become an elite performer. You're going to have a lot less likely chance of dying from a chronic condition if you were an elite performer and you had to be 70 years old or you're hypertensive. Now, for all of the patients, being a high performer was sufficient enough. There was no real change going from if you were under 70 years old and you didn't have hypertension to go from being a high performer to an elite performer. We didn't see really a drastic reduction in the likelihood of you dying from a chronic degenerative condition like obesity, coronary artery disease, and things of that nature. So when we look at elite performers, they had actually an 80% reduced chance of dying from all-cause mortality. Now, if you were a low performer, if you were cited as a low performer, that was a more diagnostic clinical risk factor than actually being diagnosed with coronary artery disease, a smoker, or a diabetic. So if we test patients, their cardiorespiratory fitness, we can actually we can get a better indicator if your chances are higher for all-cause mortality than actually just looking at if you're a smoker, if you're diabetic. Now, it doesn't mean we want you to be a smoker. We don't want you to be a diabetic, but this actually was the same or greater predictor of all-cause mortality. And that brings up to the point, like, I'll screen patients at my office. Do you work out? And a lot of patients will say, yeah, I exercise 5 days a week. But that's just give me a good idea as if they're moving. But does that mean they have a high level of cardiorespiratory fitness? And not necessarily, the answer is. I'm all for walking and being aerobic and using oxygen. And that's going to be good for general, maybe weight loss, weight management, aerobic activity. But if we don't give you, or if you don't provide enough stimulus to actually improve your cardio, your heart, and your lung capacity, you're probably not going to, we see it, you're not going to get the same benefit, because if we test you, like say we do a 3-minute step test, and after you do the 3-minute step test, we test your heart rate, and it doesn't come down to a certain range, and we say, oh, you might be in the below average level, or the low end of norm. That's a good predictor if your chances are higher of having all-cause mortality. So would it behoove you to tax your body a little harder, bring up your heart rate, get a little uncomfortable, providing that your doctor, your primary care provider, or your cardiologist has cleared you for physical activity. We also see there's no danger if you've been cleared by your your cardiologist or your primary care doctor to exercise. It's actually detrimental if you don't. And it's okay to be a little uncomfortable. And as you build and make yourself more uncomfortable, you'll be able to do more. So I guess the last thing is that elite performers. So when we get these guidelines or these graphs to determine where a patient should fall based on age and gender, the elite performers had a functional capacity, increased capacity of the heart and lungs of greater than 55% compared to what we thought they would do. That's actually greater than the estimates that we saw. So they were training well and training smart and improving their cardiovascular function. So I guess one last thing is just don't be afraid. And what's this pertain to chiropractic is we know if you have if I'm dealing with patients with low back pain, neck pain, or headaches, that if a patient can get good blood flow, good oxygen, to their spinal muscles and tissues, they're going to heal at a much faster rate than somebody who has poor cardiorespiratory fitness, such as somebody who's a smoker, that has coronary artery disease, has hypertension. So it would behoove you to get moving, improve your cardiorespiratory performance, not only for improving spinal pain and dysfunction and getting out of pain, but also to prolong your life from not having that same chance, up to an 80% reduced chance of not having death due to a chronic degenerative condition. So hopefully this makes some sense. If you guys have any questions, want to get tested, I can do a 3-minute step test to anybody that's interested to see where you fall in regards to your cardiorespiratory fitness. Just shoot me an email. We can set up a time. We can talk. If you just want to email back and forth or you want to talk to me, I'd be happy to do that. Until next time, I hope everybody has a great day and a great week. Take care.